Hello, my name's Jennifer. I'm going to be your nurse today. I am here to perform a head-to-toe assessment just so that we can see how you're doing. It's going to take about 15 or 20 minutes. Is that okay with you?
Yeah.
Okay. Well, can you start by telling me your name and date of birth?
My name is Margaret Jane Schneider, 5'11" of 90.
Okay. Are you in any pain right now?
No.
And are you allergic to any medicines or anything in general?
Nope.
Okay, so I'm gonna ask you a couple more questions. They may seem a little silly. Can you tell me where we are?
Burns Jewish Hospital.
Okay, and what season is this?
Summer.
Okay, and what is the year?
2020.
Okay, so the patient is ANO times 4. Her facial expression and mood is appropriate for the situation, and her speech is clear. So I'm going to start this assessment by, and she doesn't appear to be in any acute distress. I'm going to start this assessment by taking a look at your skin, and I see that her skin color is appropriate for ethnicity. I don't see any wounds, lesions, or incisions. And I'm going to take a look at your nails. Her nail beds are pink, and her capillary refill is less than 3 seconds. I'm going to have you make this motion here for me, all right? And I don't see any signs of clubbing. So, and her skin is warm and dry. So now I'm going to move on to testing your, taking a look at your head. Is that all right?
Mm-hmm.
Okay. So I don't see any signs of any lesions or infestations. So the next thing that I'm going to do is assess a couple of cranial nerves. I'm going to start with cranial nerve number 5. And in order for me to do this, I just need you to clench down your teeth. Okay. And then I'm going to have you close your eyes, and I'm going to touch your face with a cotton ball. And I want you to say the word now when you feel it.
No. 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 No.
All right. So that lets me know that cranial nerve number 5 is intact. Now I'm going to assess cranial nerve number 7. Can I have you smile for me? Frown. And puff out your cheeks. Okay. All of that is symmetric, so cranial nerve number 7 is also intact. Next, we're going to do cranial nerve number 11. So if I get you to hunch your shoulders, okay. And then I want you to push against my head. Actually, rotate your head for me. There you go. And this way also. All right. Then that lets me know that cranial nerve number 11 is intact. The next thing that I'm going to do is to take a look at your eyes. I see that there's no redness or drainage. And I'm just going to take a look with my pen light. So I'm going to have you start off at the computer there. Okay, and then follow my pen. All right, so pupils are equal, round, reactive to light and accommodation. Pupil size is 4 millimeters. The next thing I'm going to do is assess cranial nerves number 3, 4, and 6. But before I do that, I want to just take a look here. I see that her sclera is white and her conjunctiva is pink. Okay, so now we're going to assess cranial nerves number 3, 4, and 6. So I'm just going to have you hold your head still for me and follow my pen. All right, so cranial nerves 3, 4, and 6 are also intact. The next thing I'm going to do is take a look at your ears. Okay, and I see that the ears appear normal and there's no drainage. Now we're going to assess cranial nerve number 8. For this, I'm going to stand behind you, have you cover one ear with your hand, and then I'll whisper something into the opposite ear, and I want you to repeat what I say out loud.
Apples.
Okay, we're going to do the other ear.
Say that one more time. The Cubs are great.
Yes, so I see that cranial nerve number 8 is also intact. The next thing I'm going to do is to take a look at your, take a look at your nose. And I'm going to have you tilt your head back for me. Okay, pretty light, don't feel me now. We can. 1 second. We're having some technical difficulties here. All right, tilt your head back for me. All right. I see that there's no asymmetry, deformity, or inflammation, and no drainage in the nose. And now I'm going to have you plug one nostril and snip and do the other for the other nostril. All right, and she has bilateral patency. The next thing we're gonna do, of course it works when I put it down, is to take a look at your lips, gums, and mouth or tongue. So if I can get you to open your mouth for me. All right, so lips, gums, and tongue are all pink and moist. Now we're gonna assess cranial nerves number 9, 10, and 12. Okay, so I'll have you open your mouth, lick your tongue out, and say ah. All right, I see that the uvula rises and the uvula and soft palate rise. And can I get you to say light, tight, dynamite?
Light, tight, dynamite.
All right, so I can hear the L, the T, the D, and the N, and that lets me know that cranial nerve number 12 is intact. So cranial nerves number 9, 10, and 12 are all intact. So we are done with that portion of it. What I'm going to have you do now is just relax as much as possible. I see that she's not using any of her accessory muscles. I'm going to take a look, listen to your lungs check your respiratory status, okay? So ideally we are in a healthcare setting, but we will not be auscultating over bare skin, but if this was an actual exam on a true patient, we would auscultate lung sounds over bare skin. So just breathe as normally as possible for me. All right, so we're gonna start with the right upper lung, the left upper lung, the left lower lung, the right middle lung, the right lower lung, and the left lower lung. Okay, now if I can have you sit up for me, I'm going to check your posterior lungs. Starting with the left upper lung, right upper lung, right lower lung, left lower lung, left lower lung, and right lower lung. Okay, so all lung fields are clear and I hear no adventitious sounds. So now we're going to do your cardiac assessment. The first thing I'm going to do is check some pulses and then I'll auscultate your heart sounds, okay? So I'm going to start with your carotid pulse. Okay. All right, carotid pulses are 2+ bilaterally. For this next part, I'm going to have you put both legs up on the bed. And I'm going to lay you back just a little bit, and I want you to turn your head to the left. To the other left. All right, and I see no evidence of jugular vein distension, and no edema is present. Okay, you can turn your head back around. I'll sit you back up. So now I'm going to take palpate your radial pulse. Okay, radial pulses are 2+ bilaterally. I'm going to have you, we're going to slip your shoes off for just a second. And we're going to check your dorsalis pedis pulse. They are also 2+ bilaterally. In your posterior tibialis, okay, are also 2+ bilaterally. Okay, so the next thing I'm going to do is auscultate your heart sounds. I'm going to do this first with my diaphragm, and then I'm going to do it with my bell. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And now with the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, cardiac sounds would have been listened to over bare skin. I can hear S1 and S2 and no murmurs were heard. The next part of the exam that we're gonna do is your abdominal assessment. So I'm gonna lay you back. And I can see that her symmetry and contour of her abdomen is normal. Now I'm gonna auscultate your abdominal quadrants. Right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay. Ideally, that would have been done also over bare skin. Now I'm going to palpate your quadrants, starting with the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. I see no evidence of any tenderness or distension. I'm going to sit you up. Okay, so now we're going to do your musculoskeletal system. The first thing I'm going to do is check symmetry of your elbows, your wrists, and then your knees and your ankle. So I'm going to have you flex your elbows for me. Symmetry and contour of the elbows and wrists are both normal. Okay. And symmetry of the knees and the ankles are also both normal. So now we're going to do some range of motion. So flex your elbows for me, and I'm going to have you extend them. And then I want you to open your palms for supination and turn them for pronation. All right, we're going to flex your wrist, extend your wrist, and hyperextend your wrist. All right, so for this part, I guess you could probably do it while you're lying down. I'm going to have you flex your knee for me. All right, and extend the knee. Okay, let's do it on this leg here. Flex your knee and extend your knee. All right, now for your ankles, I want you to plantar flex, dorsiflex, invert, and evert. Okay, do that with the other leg. Plantar flex, dorsiflex, invert, and evert. Okay, so now I'm going to check your sensation throughout. I'm going to have you close your eyes for this. And when you feel this, that will be when you feel this, that'll be sharp. And when you feel this, that'll be dull, okay? So if you can just close your eyes and just let me know which one I'm doing.
Sharp. Sharp. Dull. Dull. Sharp. Dull.
Okay. We're gonna move on to I'm gonna pull your toes. Your support stockings down. All right, here we go.
Sharp. I can't tell through the socks. Dull.
Okay.
Sharp. Dull.
Okay. So sensation in both the upper and lower extremities is equal. Thank you. Okay, so now I'm going to check your strength. All right, I'm going to have you flex those elbows for me again. I want you to pull me towards you and push me away. All right, and for your legs, I want you to, let's do this. Bend both knees for me. I want you to pull me towards you. All right, and push me away. All right, so strength in the upper and lower extremities is equal bilaterally at 5+. And the last part of this exam that we're going to do is to check your gait. So I'm going to have you stand for me. And I just want you to take a couple steps away, take about 4 steps away from me and come back. All right, you can go ahead and have a seat. So the patient's gait is normal. And this concludes our health assessment, head to toe assessment. And I want to thank you for allowing me to do your assessment for you. And are you in any pain right now?
No.
Okay, do you have any questions for me?
No.
Okay, so I will put the bed in the Lora's lock position, the side rails up, call light within reach. If you have any questions, please let me know. And I will perform hand hygiene.